Mixed Bag 1. So can we call upon the first presenter for today? Dr. Archana Gunabalan. Yeah. So you are presenting, your paper is a prospective study on complications of SICS in patients with pseudoexfoliation. Okay, please start.
Good morning. My topic is on a prospective study on complications of SICS in patients with pseudoexfoliation. There are no financial interest and there are no conflict of interest. Pseudoexfoliation syndrome is an age-associated systemic disorder characterized by abnormal production and turnover of extracellular matrix. It is characterized by deposition of extracellular fibrillary deposits in different ocular structures. Prevalence of pseudoexfoliation in South India is 3.8%. The aim of the study is to discuss about the surgical complications of small incision cataract surgery in patients with pseudoexfoliation. Ours is an hospital-based observational study. We enrolled 44 patients who had clinically diagnosed to be a case of pseudoexfoliation and cataract. Our study period is 4 months from June to September 2022. We excluded patients who had a previous history of trauma and a recent history of uveitis and those who do not have any cataract lens changes. All of the patients underwent slit lamp evaluation, gonioscopy, tonometry and dilated fundus examination. Preoperative workup were done and peribulbar block was given. Manual small incision cataract surgery with IOL implantation was performed. We noted down the surgical complications and complications during the postoperative period and analyzed the result. Among the 44 patients who were enrolled in the study, 16 were males and 28 were females. The mean age of the study group was 70.54 years. Mostly nuclear sclerosis was observed in 40 eyes and 77% had dense grades of cataract. Preoperatively, the intraoperative pressure was 14.8 mmHg and 91% of the patients had an intraocular pressure within the normal range. Complications were noted in 79% of the patients and intraoperative complications were noted in 68%. 26 patients had a pupillary dilation of less than 6 mm. Multiple sphincterotomy was done in 20 patients. Nearly 41% of the patients had intraoperative floppy iris syndrome. 2 patients had a PC rent and vitreous loss. For them, primary vitrectomy was done and iris claw lens implantation was done. During the postoperative period, we didn't notice any iris prolapse, hyphema, residual cortex. Transient corneal edema was noted in 31% of the patient, which resolved by the end of 1 month. Preoperative visual acuity for 73% of the patient was less than 660 and postoperative visual acuity was better than 612 in 38 patients. We conclude that an increased risk of complications were observed in pseudoexfoliation patient and floppy iris was mostly associated with pseudoexfoliation. Even though complications were encountered during surgery, the overall visual outcome was bettered in a pseudoexfoliation patient. These are my references. Thank you.
Thank you. So how did you use devices, pupillary expanders in these cases, or do you manage just without any device?
I didn't use any device.
So you know, in pseudoexfoliation, the pupil is known to be poorly dilating. So if the pupil is poorly dilating, it's obvious that you will subsequently get all these complications. You know, like you said, the nucleus was not being delivered properly, retained lens matter, and all the other subsequent complications. So if you had used some pupillary expanding device, maybe you would not have encountered those complications. Okay. Okay. Thank